Hello all. Thank you so much for making the time for this second part of our pre-symposium Family Violence, Sexual Violence seminar. This morning was absolutely amazing with some great presentations, and I'm anticipating that this session will be great as well. Um, it was super exciting just to bookmark the important moment of the launch of the Family Violence, Sexual Violence Knowledge Hub, and thank all the people that have been involved in both developing that, but also providing content for submissions to our hub. This will be something we'll be building on from this point forward, and we'll be seeking submissions from the great work that we're hearing today and beyond in order to share this important evidence-based, what do you got? Research and practice evidence would be a better way of saying it, that we are all involved in producing. So as the Minister said, it creates this great opportunity for shared learning in a world that sometimes makes that really difficult. So in the interest of sharing our learning, we now are going on to this second session. I'm Mandy Charman. I'm the Senior Manager of the Outcome Practice and Evidence Network, and this is our sort of annual event that we've built on to a big extravaganza over 4 days. Before we get going, though, we'll acknowledge our country. I'd like to acknowledge traditional owners that we're each on today. For me, the Wurundjeri country, and like to acknowledge elders past, present, and future, and any Aboriginal colleagues with us today. We acknowledge that sovereignty was never ceded, and this was and always will be Aboriginal land. We have a few housekeeping slides. The way we run these sessions is we'll have the presentations and then a Q&A. If you can open your chat window at this point and put any reflections that come to you during the presentations into the chat, we will read them out during the Q&A and also ask any questions. Our presenters love questions. People love other people to engage in their ideas. So please don't hold back. If you've thought of it, somebody else will have as well. So put anything you think of in the questions. If you could keep your mics off, and if you feel comfortable, your camera's on. We are recording this, and that might have a bearing on you, but it's really lovely for presenters to be actually able to see people. If you have tech issues, try leaving the session and rejoining. We're pretty experienced at this now, but it's interesting, it still happens to us all. Contact one of our staff. We have Matt Edwards on who's provided his phone number. He's extraordinary with tech support, and that's in the chat, so perhaps just jot that down in case there's an issue. Okay, today's session we have the Centre for Multicultural Youth with a presentation on culturally responsive family violence practice with multicultural young people. Really, really important topic. Quantum Support Services with a presentation on specialist family violence youth worker program pilot, a dual case management model. And a late edition, Joining Up for Better Outcomes with CSNet, to round off our exploration of evidence in this context. So now over to the Centre for Multicultural Youth. Today they're talking about cultural responsive family violence practice with multicultural young people. We have Samira Fieldgrass. Samira is the practice lead and team leader for family violence programs at the Centre for Multicultural Youth, overseeing 2 AVITH programs and a gender equity youth leadership program. A social worker by trade, she's over 2 decades of experience working with young people and families across government and the NGO sectors, primarily in London. And Chelsea King. Chelsea is the Senior Practitioner for Sector Capability Building at the Centre for Multicultural Youth, where she leads training, resources, events and consulting services to strengthen culturally responsive practices for those working with multicultural young people and their families. Welcome, Samira and Chelsea, and over to you if you'd like to share now.
Thank you. Hi, everyone. We don't need a further intro. I'm Samira and this is Chelsea, and we're from the Centre for Multicultural Youth. We'd like to begin by acknowledging that I myself am joining from Wurundjeri country and really want to pay my deep felt gratitude and respect. I know Chelsea is also on Wurundjeri country. Deep felt gratitude and respect for being allowed to live, work and play here, and want to acknowledge the traditional owners on whose country we are based. We pay our respects and deep felt gratitude to elders past and present, and acknowledge the young emerging leaders of the future as well, and their continuing connection to land, sea and community. We also feel it's deeply important to remember to acknowledge victim survivors in this space, without which our work wouldn't be possible. So I just want to take a moment to honour those who are joining us today, those we have the privilege to work with, and those who live in silence, and also those who we tragically are no longer with us. In this work, we keep your stories, memory, and survival as core. Next slide, please, Chelsea. Thanks. So a little bit about the Centre for Multicultural Youth. Those of you that don't know, we are a non-for-profit organisation. We're quite grassroots. We're based in Victoria, in Naarm, and we provide specialist knowledge and support to young people from migrant and refugee backgrounds. So whether you're a young person who is a second or third generation migrant or refugee in this country, or whether you are newly arrived, having lived here between 1 and 5 years, we support you in a range of ways. So we have multiple youth support programs. We have, really privileged to say, we have 2 bicultural programs, one in the Pacifica space and one in the African space as well. So I'm joined today by my lovely colleague Chelsea, who I'll let her explain a bit about her role and what she does and how we came together in this project.
Thanks, Samira. And I guess we're heading into good afternoon. So nice to see you all. Thanks for coming. So my name's Chelsea, and I work in the sector capability building team, which Mandy's already outlined some of the work that we do. Training, resource development, and different public forums and consultancy services are kind of the core work that our team does. And we partnered internally with Samira's team, which we'll talk a little bit more about, which works more directly with young people, because we really felt that there was a need to create something that we could refer not only our own internal programs and practitioners to, but also the sector more broadly. So we'll talk this morning about kind of our partnership internally, but also our partnership with Anglicare.
Else. Probably worth adding a bit about my role. So I joined CMY at the beginning of 2023, and it was really exciting time for CMY because we'd got wind that we'd got this big grant from the Working Together funding, and we chose to partner with Anglicare. So I have multiple roles at CMY, the main one of which is practice lead at the organisation. But as I said, the time I started, we were really developing our family violence portfolio within CMY, and this was the first of the big major projects that we led. So like Chelsea said, we'll talk about that through the course of this presentation. Next slide, please, Chelsea. So as I said, we got the Working Together grant, and we partnered with Anglicare Victoria. So many of you here today will know the great work that Anglicare does. And it was quite exciting because us as a very grassroots organisation to partner with, we always laugh about this, what I call a beast of an NGO in the space that has, so many different programs across the family violence space. Particularly, we were really excited about their portfolio with young people in the out-of-home care space, multiple youth workers, workers based across the Orange Door, but we felt it was a great opportunity, like Chelsea said, to really plug that gap between what was happening in the youth sector and what was happening in the family violence sector.
So before we get into talking more specifically about the framework and the project that we've already mentioned with Anglicare, we wanted to do a little bit of storytelling about how we've come to the place kind of ahead of doing this work. So Centre for Multicultural Youth, or CMY, has always supported multicultural young people, and as a result of that, of course, has supported them in challenges related to family violence. But we didn't have a particular dedicated team prior to this work. So we understood and were aware of the fact that there were unique barriers when navigating the family violence service system for multicultural young people. And in December 2022, we hosted more of an exploratory public forum, and it was called Multicultural Youth and the Family Violence System. And through this forum, we gained a deeper understanding of what the specific gaps were for multicultural young people. So we had a panel and guest speakers, most of which were young people with lived experience, share their stories, some research that had been done in this space, and really clarified for us the need for something such as this framework. So soon after that forum, CMY published a policy paper called Better the Devil You Know Than the System You Don't. And this focused more specifically on that newly arrived cohort, so usually defined as 1 to 5 years in Australia. And really, again, further clarified this need for something more specific to happen in this space. So that really led to a funding bid that was put in for the Working Together project. And the project, which Samira will describe shortly in a bit more detail, provided us with the resources to develop the I Need to Know You're Safe framework. And that'll be the focus of our presentation today.
Thanks, Chelsea. So this was a real test for us to try and give you a project overview in 2 minutes, so I will do my best. I think Chelsea touched on the fact that what led this program, there'd been snippets of research done in the space, and we were really excited that CMY had started to build our internal foundation through the first project report we put out, which was the Better the Devil You Know Than the System You Don't. What we were finding in the space is there was amazing work being done in the family violence sector by many of you practitioners here, and there was great pockets of work being done in the youth sector. Now, we were first to put our hands up and say, look, whilst we're doing great multicultural youth work and family violence practitioners are doing great family violence work, what we were finding is that intersect, if you think of Venn diagrams, we like diagrams in social work and youth work, that intersect wasn't really happening. So it was a really exciting opportunity for us to come together with Anglicare and say, right, what are we bringing to the table? What are we doing well? And what are you doing well? And how do we service those young people who are basically falling through the net? So even though we'd had this amazing Royal Commission and the spotlight was finally shone on the gaps in provision, what we were finding is that there was intersectionality was being bandied about as a bit of a buzzword. And whilst there was obviously workers putting it into practice, there was a real, not fear is the wrong word, there was real lack of service for multicultural young people. So I'll give you an example. What was happening is there was family violence workers working with predominantly female victim survivors. There was some work happening with perpetrators. And then you had services for children. So if you think of young people in general in the middle of that Venn diagram, they were often falling through the cracks. Now, when you add multicultural young people into that Venn diagram, the services were even more few and far between. So it's a really exciting opportunity for CMY to partner with Anglicare and provide a youth-informed resource for the sector, and really centre youth voice as to what was missing in this space. So we'll talk you a bit through how we did that. So it involved a bit of desktop research, and we were really excited to find that there were some great pieces of research being done. So like I said, there was the internal CMY document. MCM had done a fabulous piece of research into the AVID space. Monash Uni, many of you will know Dr. Kat Fitzgibbon, who had done some great work on the I Believe You report. And then there was the family violence reform implementation report as well. So whilst these were all great in their own right, we had to amalgamate some of the research in that in conjunction with consultations with young people as well. So we knew that there was a huge gap in provision for how to support that multicultural youth cohort. So whilst there was great work again being done in the AVID space, as a general rule of thumb, that practice guidance for youth workers and for family practitioners was missing. Next slide, please, Chelsea. So how we did that, we only had a year to do what we did and quite a limited budget, but I'm really excited to say that in that time, we ran focus groups with 35 young people who were aged between 14 and 27. Now, we didn't really have time today, but if I was to give you a bit of a breakdown as to cultural identities of those young people, we were so amazed when we looked at, the breadth of range that we had. They were a mix of young people who were either first, second, or third generation refugee migrant young people in this country, which was really exciting again, because you had those young people who really walked that line between both cultures, calling themselves Australian first and foremost, and those young people who possibly had arrived within 6 months to a year. We also spoke to 26 family violence practitioners across the youth sector and across Anglicare's family violence programs as well. And that was really exciting to compare and contrast how youth workers across both orgs were doing this work. We spoke to our bicultural teams, and we also spoke to crisis response workers, to staff who were based across the Orange Door hubs. We spoke to In Touch, we spoke to Gen West, and we spoke to a lot of Anglicare workers who were in therapeutic services, case management, across justice, and in kind of outreach-based services as well. We then had a pretty rigorous and challenging review process from our young people who were involved in those consult groups as well. So there were several stages we had to jump through, and I can share with you quite honestly, I've never been so petrified as meeting with those young people when we had put all the research together, and they were really honest and slammed a lot of it and critiqued a lot of it, and we had to go back to the drawing board, and it was a really nice iterative process. But I think what we held at our heart was that this was a youth-informed piece of research, and it really centered youth voice. We then had it peer-reviewed by 2 academic researchers as well, and then we had a fabulous launch in February of this year. So that was a bit about the process. Next slide, please, Chelsea.
So this is my opportunity to plug culturally responsive practice training, but it is relevant because, I was talking to Samira earlier about just how grateful I was to be a part of this project, specifically because, core to our work at CMY and also core to this framework is this idea of culturally responsive practice. And, that kind of encompasses this, I think of it as like a toolkit of things that we need to be able to draw on to work effectively cross-culturally. So what knowledge, skills, attitudes, strategies do we need to be at the ready and be flexible and adaptable when we're working, cross-culturally with anybody? And central to this approach of culturally responsive practice is reflective practice and recognizing that we all have culture, and that culture impacts the way that we see the world and in turn how we work with other people. So you'll notice throughout the framework when you have a look at it that this is really an underpinning feature. And so, for example, there's practitioner self-reflective prompts throughout the document, which really get people to think about, as an individual practitioner, what's happening for me right now? Is there something about my own experience, my own culture, my own background that might be coming into play when I'm going through an intake process or engaging in practice with young people? And you'll see as well, we won't unfortunately have time to go into depth today, but Samira will go through and highlight the different domains that are within the framework and some better practice guidance. And those are certainly rooted in culturally responsive practice as well. So we made a conscious effort to make culturally responsive practice training available throughout the project. So we did a session, tailored session for Anglicare staff kind of earlier in the process. And CMY offers culturally responsive practice as a mandatory training for all of our staff. So all of the staff that participated in the project also had gone through that training. So I guess just to put a bit of a spotlight on this as being a core approach of ours, and on the QR code, if you scan it there, you'll be able to go through to our website to learn a little bit more about that training, the approach, and if you're interested, how to contact us and to book it in.
Charles, next slide, please. So I guess this is why you all logged on to this session, is probably for this slide, which I probably have under 1 minute to talk you through. So after the consults, we collated all the data, and what was really interesting was, as we were sifting through these reams and reams of paper and recordings and whatnot, it was really exciting that all the data naturally fell into 5 different domain areas. Now, if you're able to see that image, it was really good to align it with what was happening in the Marin practice as well. So if you can see the middle of the pie, we split it into 4 distinct categories, which were around building, exploring family and community first and foremost, building mutual understanding with a young person, connecting and collaborating, and then going on to facilitate access. Now, it would have been very easy for us to add a 5th domain in the middle of that pie, which was around safety. And when we went back to the review stage with our young people that had been part and parcel of the console, they actually slammed us and said, no, we want this to be an overarching theme that has to be a guiding principle of what youth workers and social workers and people in the sector are bringing. So that was a real wake-up call to us. And just to share a beautiful little story with you here in my 20 seconds, when we toyed with the name of the framework, I got goosebumps when one of the young people turned around because we'd gone through several iterations of a title. And it was actually a quote from one of the young people who said, I just need to know you're safe. Now, initially, we as practitioners took that as, well, obviously, as a practitioner, it's my job to keep young people and families safe. And they were like, no, I need to know you as a practitioner are safe. And we had this mind blow moment that then made us think really deeply and intentionally about what safety means in this space. Obviously, all our assessments and risk documents and safety planning are all have safety at the heart of it. But what the young people were telling us is that I need to know you are safe as a practitioner. I need to know the environment in which you're practicing is safe that I come to. I need to know you're a safe organisation, and I need to know that safety is at the heart of what you do. So that's a lovely snapshot and a whirlwind tour of the heart of our framework. Next slide, please. Is this me or you, Chelsea?
I think it's you, but we can do it together if you want.
That's all right. So what we learned from the young, sorry, I have like 5 million windows open. What we learned from the young people, this was really interesting because what they said is they didn't want this framework to be yet another burden on practitioners, that it was going to be a piece of paper that just sat on someone's shelf. So they were really intentional about coming up with some resources as well. And, it's so simple, but they wanted it on one page. So that pie chart we just showed you was something they wanted on one page that practitioners could stick up. They were really honest as well about saying that victim survivors in this space, as we know, are pushed from pillar to post, and if they get there in the first place, and are then having to repeat their story over and over again. So they were really keen on grassroots multicultural organizations to partner with bigger NGOs and do some of that work, some of that foundation and heavy lifting for them before they were to be referred into a mainstream service. So they were talking a lot about warm referrals, about providing that information to the services before the referral was made, so as they're not then having to retell their story. And some of that really gentle handover work as well, that again spoke to that safety piece. There's and obviously we at CMY Centre Victim Survivors and Youth Voice as well. So that whole, we were mindful we didn't want it to be yet another piece of research where young people's stories are exploited or they're being, pushed into the limelight to retell their story as victim survivors in their own right. But it was about raising awareness across communities about how we respond better and how we can assist young multicultural victim survivors in this space. So what we heard from the sector, I don't need to talk to you about some of the quotes there, but it was really heartwarming when we did our launch to hear what the sector had to say. So one of the things that really stood out to me, someone who attended the launch took us to one side and said, it's really nice to see practice being decolonized and thinking outside of Western frameworks that a lot of the sector is used to. There was this repetition as well that our young people had said that if we had genuine partnerships across multicultural orgs, we can create more meaningful and representative referral pathways. One of the things that was echoed across the space as well, particularly in the youth space across Anglicare and CMY, was this second point here about when we're assessing young people, we need to look more to what isn't said in this space. And we know that when language is a barrier or when young people are hesitant, to want to share for fear of trust. Intersectional work, as you know, I mentioned at the beginning, we wanted it to move beyond a mere buzzword. So it's refreshing to see, people shared with us, it was refreshing to see and hear about what decolonized practice can and should be. This last point was really important as well, about humility in this space, and for practitioners to actually question, like Chelsea was saying earlier, what place of privilege and what power we bring to this work, and being open to accept that we don't know it all, and this is a learning curve for many of us, but at least it's a foundation, and it's the start of a conversation of where we start this work.
And lastly, just wanted to, I guess, acknowledge that we're 18 months from the launch of the framework, which we mentioned earlier, and we recognize this is just the beginning, and we're really excited to have received some additional funding to further the Working Together project. So we have a new pool of young people who are going to be doing some work with us in the next few months. So we're going to be delivering another session to the sector as a bit of a plug. So that'll be next month, and maybe we can chuck that in the chat. And we are also available to provide capability building support to you all as well through training and workshops, secondary consults, etc. So we'll maybe put our contact details in the chat box if that's all right, Mandy. And yeah, really happy to be in touch with anybody who would like to find out a little bit more about what's possible. So yeah, thank you very much for having us.
Sounds like a totally fascinating project, or mission, really, like change, advocacy change, at the nexus of a whole heap of siloing of services, youth, family violence, multicultural. So such a rich space. I'm just aware of the time, but I did think, look, you've left us with a lot to think about. And wondering, I was going to ask about your next steps, but if you were to leave the audience who are practitioners, leaders, with the top lessons or ways they could take a step forward with this space, and I imagine first of all would be reach out, build partnerships. But so yeah, over to you. What would you say would be things? Hard question.
Well, I think just centering youth voice, Mandy. So for, you know, a lot of organisations will say to us, we haven't the first clue of how to go about that. I think we're really privileged to be in a space now. You know, I've been in practice for way too long, but to actually see how lived experience kind of comes in and out of fashion, so to speak. But I think now it's really being centred in the family violence space, in the youth workspace, in the sector as a whole. So I think really encouraging organisations, no matter how grassroots you are, no matter how mainstream you are, really centre that youth voice and that lived experience in it, you know, and I don't need to say this, in a non-exploitative way. So really centering that voice and doing small bits of research, or whether it is partnering with a smaller organisation to actively get that youth voice.
And what would you see? I mean, people may see a number of barriers in relation to that. How would you think that they would best set themselves up to manage a successful approach?
How long do I have? Look, I think that there's two things that come to mind for me. I think when it's victim survivors who are still in this space, particularly in the multicultural space, we, you know, there's a whole, that's a session in itself, I feel. But I feel it just, they don't necessarily have to be victim survivors. I feel just talking to young people about their experiences. I think if we were, you know, to do a snapshot survey of who's in this room today, everyone here will have had an intersect with someone who is going through the issues that we work with. So I think just, yeah, being quite mindful about how we do focus groups, whether we do consults with people with lived experience, or whether it's just general kind of consults in this space. I don't know if that's answered your question, but I feel I could probably talk an hour on that, Mandy.
Oh, absolutely. There is an absolute skill set around this. And I just think what I'm hearing is be bold, put yourself out there, don't put it into the too hard basket, because it will reap so much better results, and be more true to our sort of ethics and principles as well in terms of decolonising practice. So I just loved your framing, and I can't wait to hear more, frankly. And I'm hoping everyone else in this room feels exactly the same. Thank you so much. tiny little bit of an insight, and I'm hoping we'll all follow up. We might now need to move on, which is the disheartening part of this